visible, the difference between, let's say, well-funded academic institutions versus poorly funded ones, or the difference between poor students in rural areas with poor connectivity and well-to-do students in urban areas with good connectivity, or between another example, between top lawyers whose briefs are bursting and smaller lawyers who are running around without actually getting any. So there are huge differentiation between the way that this pandemic, as well as the way that the remedies that we are adopting in the digital mode are playing out. And let's look at these four elements. As I said, the uneven spread of telecom infrastructure, whether it is simple mobile connectivity, all the way up to reliable broadband connectivity or even 5G connectivity, is one huge factor that differentiates one person or one area from another in terms of the impact. Let's look at the cost and affordability of hardware, from simple mobile telephones, feature phones, to very small phones, to higher end laptops. The affordability of this kind of infrastructure really begs the question, how do you make it work for all? Shared resources is one such methodology. In India, we have, for example, the common community services, which try to bridge the gap of lack of affordability of this hardware as well as lack of digital literacy. Then we have, the third element that I talked about, which is digital services, applications, and platforms, which are supported by innovative service providers. Some of you may have used, for example, healthcare services at a time where people who do not have COVID are afraid to go to a hospital for fear of contracting COVID. How do they get treated? And again, advances like remote healthcare, platform providers like Practo, for example, and similar such platforms, other platforms in healthcare, in agriculture, in education, are all playing a role. Not only universities and IITs, but also in schools, free content of very high quality by philanthropic organizations like Khan Academy, or commercial enterprises like Byju's, or NGOs like the Premji Foundation. All of these have played a big role. And platforms like UPI have enabled payments in a big way. At the start of the pandemic, I, as a precaution, withdrew 50,000 rupees to keep at home just in case we needed it. And I still haven't actually used that because almost everything is being paid. The fourth element that I wanted to talk about is the data itself. And we've seen the importance of data, where, for example, data for public good, not the kind of commercial data that is used, but for example, mobility data is seen as a good indicator of the spread or influence of the pandemic. It's also seen as an advance indicator, a leading indicator. And we've had instances, very heartening instances of platforms like Google and Facebook sharing mobility data, of course, at an aggregate level, no violation of privacy involved. But that clearly shows the correlation between, the spread of the pandemic and mobility data. One other dimension arising from all these four elements is that today we have digital companies dominating the economic landscape and growing bigger and more valuable, while at the same time, small and medium enterprises are getting wiped out, also under the second wave. We've seen the impact of this on individuals, daily wages and so on, even in the first wave. So both at the individual level and at a corporate level, the accelerated rush to digital is magnifying some of these divides at an organizational level. At the same time, the digital march also spreads opportunity, provided people have access to that opportunity. If there is a job and you are qualified for it, no matter where you are sitting, you can actually get anywhere in the world. It's not just a question of being next. So it is therefore imperative, when you look at all of these aspects, to increase and ensure the spread of reliable telecom infrastructure, affordable or shared, digital resources, equitable access to data as well as to opportunity, and skilling of people and export of IT and other services which are phygital all across the world using digital media and tools. There is really no time to adapt. That is one of the challenges of the pandemic, that it has given us no time, not even the usual amount of time to adapt. And so we need to have rapid action to quickly ensure that all of these facilities that we are talking about, which are helping us to cope, are actually available to all the people, both in terms of connectivity and progressively address the other issues. Lastly, I want to end up with a quote by Mr. Kofi Annan, who said that in today's world, connectivity is as important as the basic needs of people. They are important for livelihoods and for ensuring well-being. Today, we have come to a stage where those words are prescient, and it's not only important for livelihoods and well-being, it is important for life itself. And that's a sobering thought, and I do hope that we will continue to rise to the occasion. And my greetings to all of you on this Telecom Day. Thank you very much for the opportunity to be here with you today. Thank you.
Thank you, sir. Thank you very much. Wonderful expose on this whole COVID-19. I think this is really good ideas that you have given. We will follow up on those. Now I would like to invite Madam Additional Secretary, Department of Telecommunications, for her chief guest address.
Shri Bhatia, Shri Dua, Shri Chandrasekhar, His Excellency Mr. Malcolm Johnson, Deputy Secretary General of ITU, all distinguished participants on virtual mode. A very good morning to everyone, and greetings on the World Telecommunications and Information Society Day 2021. At the outset, I would like to congratulate ITU-APT Foundation of India for hosting this virtual discussion on the theme of accelerating digital transformation in challenging times. We all would agree that till the early part of last year, no one could imagine the kind of challenge that has been thrown at humanity by the pandemic, which continues to ravage. It has been an uphill task to create medical protocols to handle the enemy with a completely unknown and unpredictable behavior. It is still evolving, and we cannot predict its end and relax. All the countries are engaged in the fight against COVID-19, and science and technology are racing against time to emerge victorious. Our daily lives at work and at home, our interactions with each other, the way we think and how we respond to situations have undergone sea change during the period. While we are deprived of social and formal interactions in person, a new behavior has emerged which is supported by the ICT and telecom networks. In the last pandemic, no one could have imagined the kind of format that has emerged in the present world. A common link which developed in our global action against COVID-19, leveraging the potential of information and communication technologies to provide robust, reliable, and pervasive communication. Given the complexity of governance, reaching out to different parts of society and remote areas, and ensuring the essential communication has been the need of the hour. I wholeheartedly appreciate all those whose relentless efforts have enabled the communication networks to keep up through the connectivity 24/7. In continuation of our collective response to the pandemic last year, through development of several applications and services, I would further urge all our industry, academia, especially the startups, to come together to bring out innovative solutions using IoT-based sensors and various wireless technologies for monitoring essentials of healthcare and emergency services for effective life-saving service delivery in various parts of the country. During the field trials, pilots, and further developments, these applications and public safety may be given a focused attention on priority so that India's preparedness can be improved, not only for immediate need, but also for any eventualities in future. ICT is an important tool for modernization and transformation of the industry, promotion of inclusive economic growth, and stimulation of the national economies to meet the SDGs. Our National Digital Communication Policy is a comprehensive document, and DoT is closely monitoring its implementation to establish a ubiquitous, resilient, and affordable digital communication infrastructure and services in our country. In the difficult times that the world is going through, we know that we will finally emerge having fought bravely, with some scars, I must say, but victorious. However, the need will be to prepare hard for future onslaughts, which we cannot deny may come. The governments, industry, and citizens will have to prepare and be ready to face the challenges which may be in store. In addition, the path of progress and development has to be aided by research and development and emerging technology. We all will have to contribute our bits to the goals of development. The Department of Telecom has been working on a path to reach the frontier. Through BharatNet project, DoT is progressing to connect nearly 600,000 villages by laying optical fiber cables. This connectivity will give a boost to penetration of communication to the remotest part of the country. Satellite communication services are also being used to reach inaccessible and difficult areas in close collaboration with Department of Space and other stakeholders. Further, submarine cable networks projects have been completed for Andaman and Nicobar Islands, and steps are being taken to connect Lakshadweep Islands also. The COVID-19 pandemic has necessitated delivery of stable and high-speed broadband services through public Wi-Fi to an increasingly large number of citizens in the country, including areas which do not have 4G mobile services. In a bid to provide more public Wi-Fi services in the remote areas, the department has recently announced setting up of the PM Wi-Fi Access Network Services known as PM Vani. The salient feature of PM Vani initiative is that the ecosystem will be operated by small and medium players, and there will be no license fee for providing broadband internet through these Wi-Fi networks. These digital initiatives by DoT are unique in the sense that they will cater to all types of business entities, be it small, medium, or large. The department has taken many policy initiatives towards fulfilling the ICT needs of the citizens and enterprises in a holistic and inclusive manner. These initiatives have increased relevance today as the objective is to provide affordable services through optimal utilization of resources such as spectrum and telecom infrastructure. Spectrum sharing and spectrum trading guidelines are already in place for efficient and effective use of spectrum resources. The policy of sharing of telecom infrastructure by the telecom service providers has brought down the requirements of CAPEX and OPEX in expansion of telecom networks, thereby allowing the operators to extend affordable telecom services in remote areas. DoT is continuously consulting all stakeholders to bring in more and more policy innovations for further improvement of telecom infra as per emerging and future requirements of the sector. As part of the continued efforts to improve ease of doing business, DoT has recently facilitated work from home and work from anywhere through new guidelines under the other service providers category. And many restrictive provisions have been done away with and taken out of the ambit of OSP regulations. DoT will continue to make efforts in this direction in consultation with all stakeholders to further speed up various processes. I would urge all DoT officers and stakeholders to continue efforts for increasing awareness on continual basis, especially in the context of 5G services coming up, so that further faster development of these next generational services can be done smoothly. I'm glad to share that establishment of ITU Area Office and Innovation Center in India is in advanced stage. The ITU Area Office and Innovation Center will provide immense opportunity for academia, SMEs and startups and industry partners from all developing countries in the region to actively participate in the development of futuristic technologies. This will also provide opportunities of carrying out joint research, development projects and innovation networking for the South Asian member states in partnership with ITU for accelerating the digital transformation and bridge digital divides in the region. I urge all the stakeholders to leverage their strengths and closely collaborate amongst each other to realize the envisaged objectives of the meeting, the Sustainability Development Goals. Finally, I would like to thank you for giving me the opportunity to share DOT's initiatives towards a better India. I look forward to participation of all stakeholders in these initiatives of DOT. Thank you and stay safe. Namaskar.
Thank you, madam. Thank you so much. I think you have really given a lot of good information, and we would like to compliment DOT for the number of steps that they have taken. In particular, your reference to PM Vani, I think that's a very great initiative. And also the ITU area office, we certainly hope this will come up soon. And I think the steps that DOT has taken in moving forward with the ITU area office is really commendable. And all other steps that you mentioned. And I think this is the DOT's leadership in this area has really helped the nation in meeting the challenge of COVID-19. Thank you to you and to all your team in the DOT. Thank you, madam. Now I would call upon Mr. Malcolm Johnson to deliver his inaugural address. Mr. Malcolm Johnson, please.
Thank you very much, Mr. Bhatia. Mr. Chandrashka, Madam Praveen, distinguished speakers, dear participants and friends, good morning. Namaskar. I'm very pleased to be able to join you at this event and have this opportunity to wish you all a happy World Telecommunication and Information Society Day. I would like to thank my good friend Bharat Bhatia, President of ITU-APT Foundation of India, for his kind invitation and for organizing this event to celebrate the day. Let me start by expressing my deepest sympathy with you all for the terrible situation you are facing in India as you battle the second wave of COVID. Our hearts are with you at this difficult time, and I hope my friends there are all safe and well. World Telecommunication and Information Society Day is an opportunity every year since 1969 to celebrate the benefits that the technology can bring to societies and economies. The day marks the foundation of the ITU on the 17th of May, 1865. And I'm sure in all those years, there's never been more reason to celebrate the day. Where would we have been over the last year without the telephone, without mobile phones, without radio and television broadcasting, and without the internet? India's embrace of the technology is helping people keep abreast of health advice, to continue working and studying from home, and keeping in touch with friends and relatives during this pandemic. It's encouraging to see several new ICT innovations being deployed in India to help overcome this crisis. This year's WTISD theme, Accelerating Digital Transformation in Challenging Times, recognizes the critical role of telecommunications and ICTs to the resiliency of societies and how ITU membership and its partners have stepped up and engaged in activities that have proved essential in saving lives and sustaining economies. As we know, there are still many that are unconnected, especially those living in rural and remote communities, which is a large proportion of the Indian population. Many efforts are being made to bring affordable connection to these people, and these efforts now have greater urgency than ever before. ITU is here to assist you in this effort. And the ITU Connect 2030 agenda, adopted by ITU's membership, aims to close this digital gap. This year, our membership is focusing on the key goals and targets related to digital transformation, such as digital strategies, e-government, cybersecurity, emergency communications, innovation, and partnership. ITU's membership of governments, businesses, academia, civil society, and other regional international organizations, including, of course, the ITU-APT Foundation of India, need to further strengthen their collaboration and cooperation at this time to reinforce the development of digital strategies and other technology-driven initiatives. One thing that COVID has clearly shown is that we are all interdependent on each other. As with cybersecurity, so with COVID. We are only safe if everyone else is safe. Multilateralism is more important now than ever before. And so ITU's role is now more important than ever before in its long history. We very much appreciate all the work ITU-APT Foundation of India is doing to help collaboration between ITU and India, its contribution to our studies, and especially its efforts to increase the participation of India in our work, including the academia and SME membership categories. I'm very pleased that we will soon have a new ITU office opening in Delhi to cover the South Asia region. We hope that this will encourage and enable greater participation from India and the region in ITU's work. Finally, I would like to invite you to visit our dedicated WTISD web page on the ITU website, where you can find tools and resources developed by ITU and the details of our WTISD celebration, which starts here at 1300 Geneva time. Today is also the start of the final week of this year's very successful WTISD Forum. So I hope you'll be able to join us for some of these events during the week. Let's look forward to celebrating next year's WTISD and hope we'll be able to celebrate it in person and give recognition to telecommunication and ICT's contribution to overcoming COVID. Thank you, and I wish you all keep safe and well. Dhanyawad.
Thank you, Malcolm, and thanks for that message, and hope we all join next year on 17th May in person. And with that wish, I think that could be the best solution that telecom sector could offer to the whole humanity. Thank you for that, and hope to see you soon in India also. As soon as the things improve, we will certainly have a meeting.
Thank you very much, Bharat. I always very much enjoy my visits to India, so I'm really missing not being there.
Thank you. Moving straight on, I know we have a packed agenda, so I will now thank you, Malcolm, and we would now move on. And may I request Mrs. Deepa Tyagi, she is the head of the TEC, to provide her initial comments for the next part of the program, where we have a number of very detailed, excellent speakers. Deepa ji.
Distinguished guests, panelists, colleagues, ladies and gentlemen. It is a great privilege to be here today at this ITU-APT Foundation event on World Telecom and Information Society Day. My sincere thanks to the organizers and participants. I'm sure, like me, most of you share this conviction that the telecom sector continues to be a pillar of hope in these grim pandemic times. India's mobile phone-driven society has emerged as one of the main lines of defense against COVID-19. There have been many successful stories to prove how critical the mobile communication has been in our fight against COVID. I'm not going to repeat, as they have been covered in sufficient detail by speakers before me, and some speakers after me would also be dwelling upon these issues in detail. During these difficult times of human history, it is a great respect to have technologies that ease life and save lives. Current Homo economists realize that ICT has become cardinal thread in the ambitiously emerging civilizations. The world has never been more interconnected,
And this health crisis is affecting the whole world. It has brought home the reality of Industry 4.0, digital workflows, robots, automation that are no longer goals, but they have become requirements. IoT devices have offered organizations a path towards preserving revenue streams during this pandemic. Of course, due to constraints of time, I would not like to elaborate on these technologies that have impacted every aspect of our lives. As far as health sector is concerned, ICT is taking medical inventions and services to an altogether new domain of knowledge. But standardization of technology and structuring the application of technology using data fusion is essential to face future challenges. Interoperability of medical technologies, safety, security, and public health has to be defined and standardized. Since ICT is becoming a major component in public health management and intrusion of cognitive technologies in the medical field are becoming predominant, there should be strong standardization regulatory mechanisms in place to avoid fatalities. No doubt, everything has risk. There is nothing without risk under the sun. But the systematic standardization of rapidly emerging technologies will mitigate and minimize risk. I would like to encourage all of us to take this pandemic as an opportunity to use ICT technologies for creating a just, equitable, and sustainable world. The equitable provision of healthcare is essential to achieving developments in any society. The need for health equity arises from inequalities in health status, healthcare utilization, and healthcare financing. The concept of health equity arose from the belief that differences in social and economic backgrounds of people leads to differences in their ability to access healthcare. In other words, groups of people who are already socially disadvantaged due to their poverty, gender, racial, ethnic, or religious backgrounds are further disadvantaged with respect to their health. This equitable healthcare can be achieved using information and communication technologies to collect, store, and analyze data to arrive at treatment options and interventions. India has the world's second largest pool of internet users, about 700 million, comprising more than 12% of all users globally. Yet, around half of its population lacks internet access. And even if they do get online, only 20% of Indians know how to use digital services, according to a government data. In spite of such a spectacular mobile success story of mobile communication and data consumption, India's digital divide remains deep and persistent. It is multidimensional and it is growing across states, within states, and across gender groups. COVID-19 lockdowns have exposed and highlighted India's great digital divide as never before. Despite the rise in wireless users in recent years, urban and rural India are miles apart in their online presence. So how do you bridge the gap? Probably there are some things which we need to focus on. Reliable and less erratic electricity supply, which is a key to digital foundation. The second is availability of smartphones for everyone, which means cheaper and affordable devices. Third, digital literacy is required for using digital services. Development of digital services in regional languages is very essential too, for fast understanding and making it popular. And last but not the least is how to make digital transactions user-friendly and secure so that rural people have trust and confidence over the system. A lot more needs to be done to improve the digital data and ecosystems, the ease with which people can connect, collaborate, transact, and share information. Digital technology can play a key role in improving access to the education system and create affordable and effective education and training programs at a larger scale. Public and private partnerships in digital technology infrastructure, data storage, data centers, and content hosting infrastructure will need to be scaled up to connect people and cities. Concerns of digital colonialism would also have to be addressed, and market-based approaches will have to be shifted to a more regulated approach. This transition towards a more regulated approach as to how data can be collected, stored, and processed at national and global levels is still at an early stage and raises many societal and ethical questions. Drawing the line between self-certification and regulation remains a key challenge of private enterprises. Explore internal ethics boards and external audits and governance frameworks. Global regulatory frameworks on cybersecurity, AI, digital trade, and more are still evolving. There is no one-size-fits-all solution, as there are different options for operationalizing and implementing digital regulations at national and global levels. The key is that regulations should not impede the nature and pace of innovation. Increased global digital cooperation is the need of the hour and far greater than global cooperation in goods trade, given the intangible nature of digital assets. The importance of global digital collaboration has become greater following COVID-19, which has shown how interconnected we have become as a global society. Of course, the government is clearly pushing for a lot of digital transformation projects. As Anita ma'am said, there is BharatNet project. Then in 2015, the government launched several schemes under its Digital India campaign. Then we have the Pradhan Mantri Gramin Digital Saksharta Abhiyan. And then, of course, the most recent initiative is the PM Vani. But key to bringing 5G to hard-to-reach rural communities is the extension of wired networks. We must scale our communications infrastructure and lay lots of fiber. To close the urban-rural digital divide as soon as possible, broadband optical fiber connectivity needs to be deployed widely in parallel. The key is for our global society to have a holistic point of view in implementing broadband infrastructure, where reducing the socio-public loss should be the central aim, rather than increasing the return on investment. Of course, there is an ITU initiative, BIRD, Broadband Infrastructure for Remote Area Digitalization. This solution has been proposed. It was built on the affordability first concept, lightweight, robust optical fiber, and simple do-it-yourself installation by non-skilled local people. And this has respectively been following ITU recommendations like L1700, L110, L163. There have been certain pilot projects in Nepal and Mongolia, but it is high time that we did these experiments under the aegis of ITU within the country. There is clearly a need to explore the possibility of the unprecedentedly standardized ITU-T solution and how to quickly and globally penetrate the solution towards bridging the digital divide and stopping the pandemic, particularly in remote areas in India and other developing countries. TC is the technology arm of the Department of Telecom. It is the national standard setting body. We also adopt national standards, and I'm pleased to inform that we are currently examining the ITU approved TSDSI 5GI standards for adoption as national standards. These standards will all go towards interoperable, standards-based, safe, secure, and quality products in the network. We are also the mandatory testing and certification agency in the country. And this testing and certification is done against the essential requirements, which are a set of standards which TC comes out with. We are also the point of contact for addressing issues related to technical barriers to trade, WTO TBT. And last but not the least, we are the single point of contact in the country for all ITU-T related activities, and we steer the national working groups corresponding to the ITU standard study groups. On this special day, we would like to say that we look forward to having a more closer and a deeper collaboration with ITU in our endeavor for a smarter and a more digitally empowered India. With this introductory note, I would now leave the floor to the rest of the panelists of the technical session. Thank you very much.
Thank you, Deepa, for your very nice and very elaborate coverage of this subject, particularly on the standardization part. And thanks for that. I would now like to invite Mr. Dilip Chennai, Secretary General of FICCI, a great friend of ours. Over to you, Dilip.
Thank you, Mr. Bhatia, for this. And if I may just say that it's an honor to be part of this wonderful session. To all the dignitaries, Mr. R. Chandrasekhar, Srimati Anita Praveen, Srimati Deepa Tyagi, Mr. Malcolm Johnson, Bharat Bhatia, T.R. Dua, Professor Goel, Vikram, Dr. S.K. Mishra, Dr. R.K. Upadhyay, Dr. Aloknath De, all the other experts, a very good afternoon, and just hope that you, your families, your colleagues and their families are all safe, and please continue to stay well and keep safe. I actually have heard a lot of the previous speakers, and therefore I might be repeating a few things, but I would also add to what they have said. I think congratulations first on celebrating this World Telecom Day. And Mr. Bhatia, remember last year you used the same line saying that next year we hope to be celebrating this physically. Unfortunately, that did not prove to be true. I hope this, at least in some parts of the world, it is happening. But I think in India, we hope at least next year it will come true. Again, our thanks from all sections of society, in particular industry, to all the workers in this sector for keeping the great IT and telecom services going. It has really enabled the economy to continue and kept us all in contact, including enabling us to do this webinar as we are there today. As Mr. R. Chandrasekhar said, I think the theme for accelerating digital transformation in challenging times, how does ICT sector is responding to COVID-19? I heard him say that perhaps the real challenge of COVID-19 accelerated the adoption of ICT within different segments of government, the economy, society, and individuals, not only in India, but across the world. Last time I had mentioned that it's not necessarily the CEO, the CIO, the CTO who is driving digitization or use of IT and telecom services, really the pandemic that is accelerating this exponentially. I think there are about 10 different areas that we are actually looking at, and where the IT and telecom sector, ICT sector has transformed itself during the pandemic. And this is in a kind of a transformation that has begun. And when you go to the new normal, many of these will continue to exist. Yes, like Ms. Tyagi said, we need to do the standardization, we need to do all of that, but let me focus on those 10 sectors. So the first thing happened was providing ITS services, moving out from a central location to work from home, distributed ITS services. The government amended the laws. It enabled this to happen. There are issues of security and others which collectively we need to address. Second, the telecom services never had a single seconds outage there. Tremendously commendable. It provided us to actually keep in touch. And in fact, many of the companies have started upgrading their broadband and other services during the pandemic, giving you greater bandwidth and allowing multiple people to actually use the services from one home. Earlier, the concentration used to be in the industrial clusters or in the commercial centers. Now it has been distributed to a much larger area. The third is, I think, the whole connectivity and bandwidth services for broadband and the VC like today for corporates, NGOs, and different sectors. Mr. R. Chandrasekhar mentioned education and health, but I'll come that to a little later. But then the fourth thing was the entire thing of contactless delivery and contactless payment and contactless, the whole e-commerce and the local kirana shop, even pivoting their own business, your local press wala or the local milkman using the phone and app on the phone to actually deliver things to you, and also the entire UPI backbone, the Aadhaar backbone, which enabled payments to happen. In fact, contactless payments and deliveries, contactless payments have actually risen exponentially, and the whole back end to enable that to happen is perhaps not adequately appreciated. I think if you look at the whole issue of the backbone for fighting COVID. There was a mention of the Arogya Setu app and the CoWIN, right? But if you look at the whole thing, how in the Oxygen app that has been developed and it has been run by the Ministry of Surface Transport, you have integrated the Vahan network, the Saharthi network, and you've actually used GPS tags on vehicles and to track the delivery of oxygen from where it is produced to where it is required, and re-looking at all of this. So this whole backbone has been actually provided by the ICT sector. In addition, the whole code chain for vaccination is also being actually driven by that. So if you look at how engineers, NGOs, and other people are actually using ICT, or the use of ICT apps, there, you have apps for locating oxygen, for oxygen concentrators, for hospital beds, for medicines. The whole thing has actually, enabled all of us to take advantages of this. Mr. Chandrasekhar mentioned about education, and I think this is a huge thing, but I think learning management tools have come up, online examination tools have come up, online certification tools have come up, and also corporates are using this to create virtual meeting rooms, their own customized thing. For example, the FICCI has the business, the bike platform there. If you look at the whole social media, and that is somehow not really looked at, it's based on ICT. Google is actually prioritizing the Google Analytics for us to actually understand the different aspects of the economy, whether it is movement. The e-tolling system has actually enabled us to see whether the highways, etc., are moving, goods are moving in the highways or not. And I think travel was tremendously transformed since the last meeting, and you got contactless ticketing and payment was there, but you have contactless security and other things that we are actually seeing here. So I think if you look at this whole thing, and Mr. Chandrasekhar mentioned this, remote healthcare. In fact, after the last ITU meeting, we had the Telemedicine Act actually promulgated, and that enabled the companies like Practo, whom he mentioned, going forward. Also, I might say that the whole uploading and downloading in the broadcast sector, that conveniently forgotten at this point of time, but they also run on the ICT backbone. And one of the things that kept us going, although it was a challenge, I mean, Europe, a lot of that is happening, is the football leagues are being, in empty stadiums, but they're being transported to homes and keeping and helping in us retain a lot of the mental equilibrium that is required, including the IPL in India. I would like to just actually say that I think much more could be done. I think first, a lot of people have referred to this, accelerated connectivity across the country, eliminate the digital divide between the urban and rural, and within urban. I think there is also a digital divide. I think Madam Deepa Tyagi mentioned the PM Wani scheme. We need to ramp it up, scale it up, provide maybe 10x the number of free Wi-Fi spots across the country. What I would like to actually say here is that we need to understand the whole adoption of virtual as an acceptable mode of training, education, and skilling. Currently, it is seen as a substitute, and you want to go back to the normal physical way. But I think you can actually do this in a very different manner. I would like to also say that there are three things that enable the ICT to work. One is the ICT backbone. The second is mobile devices. The third is digital devices. And we need to find a way to reduce, to improve accessibility of mobile devices. In many states, it is not found, there is a hesitancy in allowing girls to have their own mobile phones. And that is actually creating a different type of digital divide as we look at it. And in some cases, we need to look at reducing the cost of usage of digital devices. In homes where there is one digital device, there may be 3 or 4 users, so we need to actually address that. And of course, the Indian language services on the whole net and others have to be promoted. I think finally, I would like to say that there's a need for coherence, communication, consensus across all segments of the sector to meet the challenges of COVID. There were points, there's differences in some points between the ICT sector or the broadband sector and the telecom sector. We need to actually put this behind that. There are separate ways you view how you do view the digital transactions. I think domestically and internationally, we need to come and achieve a kind of a clear consensus on these issues. And that will really lead to expansion of the ICT services as we go forward. ICT has also been used within industry for remote monitoring, for predictive maintenance, and that has been a huge acceptance here. And in the standard formulation, using ICT for virtual inspections, using ICT for verifying processes and processes should actually come in there. Finally, I'd like to thank you once again and end with, please, if you're eligible for vaccination, please vaccinate yourself, vaccinate family members. Even after vaccination, please continue to follow social distancing norms, mask wearing, and washing your hands and sanitization behavior, because vaccine does not insulate you from the carrying the virus, but it just prevents you from getting a significant attack. Stay at home, stay safe, and thank you very much, Mr. Bhatia, for having me here. You're on mute.
Yeah, thank you, Dilipji. Thanks very much for that comprehensive overview. And I know the industry has really rallied in a big way to meet the challenge. And I think we are all a kind of participant in that journey, where we are getting all the things delivered to our homes. We are able to connect with our families, and we are able to even get the medical aid and even the telemedicine video consultations. And with that, I will directly move to Dr. S.K. Mishra, who is known as kind of father of telemedicine in India, and like to invite Dr. Mishra for his speech. Thank you, Dr.
Though I was working with ITU Geneva as well as APT Bangkok, but this is the first time I'm getting involved with our national body. This is a good opportunity to share my opinion or that I think about the acceleration of the digital technology in these challenging times. I'll just divide this 5 to 7 minutes in 3 parts. One is just to tell you that where we are. In the last 20 years, we started the telecare. And where are we now? And what we see the opportunity for the future. This is, I'm telling you, of the user perspective. And you all know about technical perspective. I've already told about the policy and the other security issues already addressed actually. So where are we? So we started telemedicine way 20 years ago using POTS. I don't know whether POTS is now ever been taken in the mouth by anybody else. We started with POTS, went to the ISDN, and then went to satellite, then came down again to the ground, and we are given an opportunity to explore the internet-based the bandwidth, the fiber, etc. So that really the evolutions of the network engineering that you have given to us. This is a blessing for the health sector. Now we are now been practicing telemedicine in a way much different than you must be thinking actually. I'm sure all of you in the audience have practiced telemedicine by yourself. In whichever way you think that you have connected to a doctor or a service provider to take an opinion, whether it is pharmacy or whether it is Ayurvedic or English medicine, whatever it is, or physiotherapy, whatnot. So that is the way you look at telecare. Now I'm looking at it in a different way. I think that at the hour of the need, we are connected. That's the connected world that you have been talking about in the last 1 hour I've been listening. Now in the connected health world, we have to help us to how to reach that actually. So currently, what has been facilitation has been done by the Minister of Health is a policy initiative. That's a really boom for all of us who have been practicing telemedicine for the last 20 years. 25th March is a red letter day that is going to celebrate by our Society of Telemedicine that we have been longing for many, many years. The Government of India launched the telemedicine practice guidelines and made it a kind of law. And many more are going to come relating to this in the coming years. At the same time, the engineering part, the technical part also has taken next leap. And we could do telemedicine the way Patient needs it. Let me tell you, put this word, patient needs it. A person needs it, citizen needs it. There are nowhere electronic medical record. There is nowhere any standard guidelines. There is nowhere any policy security or any fear for my data security. Anybody wanted to just to be contacted with the doctors. You know all very well, in the total lockdown, this is the only way. So I must thank the engineers who have given this technology for us so that we can reach out to our consumers, that is the citizen of this country. And what we have done, let me just tell you, in these times, we have done in many of the states, the L1, L2, L3 hospitals, depending on the facilities that you have, and connected them with mobile phones. And of course, the landline together. And mobile phone has advantage of getting some of these informations like the X-rays, which you think then like CT scans, we get the information images with the WhatsApp. So social media, we have been talking about now, social media has taken a completely different perspective in the health, and it's going to stay forever. Let me tell you, telemedicine may die, but social media will never die because person or people or citizen has adopted it. So telemedicine could not take leap in the last 20 years because the caregivers and the citizens never accepted it. But now both the elements, they've accepted it. Technology is there many years back, but telemedicine was never really gone to that extent that we see today. And today, telemedicine is in practice by one and all, starting from a small nursing home to the last corporate hospital or big institutes. In enterprise manner, entire state has developed telemedicine plan. I don't have to go in detail. Everybody has something to deliver. Now we have a national policy of introducing national software. All of you know about it, e-Sanjeevani, and this has become a national telemedicine software being implemented by the National Health Mission. Now, while the telecare is going on by the state government, which is their job, now the government of India has launched some of the e-learning activities, and the Medical Commission has approved the e-learning. That is going on for nursing, medicine, and also all kinds of technical courses. And we are getting the exams also virtually. And all these things are happening since last 1 year. And this year also, we are adopting the virtual mode to conduct the examinations. Industry, you have already spoken about it. Now, industry has never been seen that it can go to that level. Today, you talk of a paracetamol tablet. You have several of these e-pharmacy options. You can get it at your home, like your vegetables or kirana stuff that you have been talking about. Now, health or telemedicine, let me tell you, has become a marketing commodity. And that's the day we have been thinking about many years. Can we make telemedicine a consumer product? Yes, that is no. And can we make this software as a tool? Yes, that is. We have been talking of SaaS, and the SaaS in the medicine is all telemedicine tools that all of us are practicing. Now, let me tell you, after doing what we're doing now, what do you think for the future? Now, I just want one point to the now, because some of the hospitals could take up telemedicine to big level, some hospitals could not. That's because we do not have preparedness. You all know that the health infrastructure preparedness is not equal everywhere. This has been talked about, starting from the oxygen plant to whatnot, or beds, whatever it is. Similarly, we do not have the digital infrastructure in the hospital. Hospitals who had some kind of digital infrastructure, they could really jump. The hospitals do not have, they have to do in a very primitive telemedicine. So now I go to the next generation. Now, next generation, that's the future that you all know. Ma'am has spoke about Industrial Revolution 4.0, which is already information science and technology. This is going to make a revolution in the medical sector. We are now talking of digital doctor. We are not talking of digital patient, digital records, everything digital. The whole world has become digital. Whole ecosystem has become digital. At the same time, we must see health is one where there has to be some human touch. There has to be some compassion. There has to be some empathy. How can you do that? That depends on the individual level that you have to think it out. How can you bring it? Now, let me tell you one thing. You are talking of acceleration. And acceleration in a health infrastructure, this is the only thing that you can really accelerate and jump, take a quantum jump. We have no doubt for technologies. With the content computing, cloud, everything is there. Unlike the beds or oxygen plant, here now itself, you can develop application. Let the system accept it. Now I'm talking of how to take the system digitally innovative so that it can advance the current health system. That is our future that you think of. Making a digital innovation system health advancement, wherein the engineers, the policymakers, and the healthcare providers are important to take the telemedicine or digital care to next level. No, telemedicine is not the only thing. in the digital environment. Let me tell you, we have been talking about precision medicine. We are talking about clinical decision support system. We are talking about data analytics that makes a policy. All these things are a part of the total ecosystem of digital technology for health. Let's not talk about telemedicine only. Let's talk about digital technology for health. So that is the expansion of our horizon, and where all of you are involved, be it a doctor, be it an engineer, be it a policymaker, be it the last is our consumer, the patient. I'll just conclude my opinion on only one thing that tell me. In the telecom world, you have been talking about last mile connectivity. Now, my slogan to all of you is, make it just add health, last mile health connectivity. You can do it. Only you can do it. Because we want only a mobile phone, which is a feature phone. Even if not feature phone, it's a smartphone of some kind, because we have to transmit some of the images. We need a smartphone, affordable, and also secure. And please take at least not 5G to 4G, or you're talking of your Wi-Fi that you're going to take with the PM's new event coming up. So please make us reach to our people, our consumers. We are talking of health wellness, not illness. We have to monitor our people. We're 150,000 sub-centers where you are supposed to introduce Ayushman Bharat wellness program. How can I do that? We're already implementing that. You must be getting some figures. We cannot get the bandwidth. That's the only terrible scenario that we are getting. SGPJ Lucknow has been practicing telemedicine for 20 years. And when you see this problems of getting this access to sub-centers because of the internet access, bandwidth, then we are disappointed. So please help us in getting that. If we can do that, we can really achieve health for all that we have been talking about for the last decades. So thank you very much again for giving me the opportunity to share my thoughts.
Yes, thank you, Dr. Mishra, and good to have you with us. I think this is an area where we can collaborate. You have been working with the ITU, and I think it's good to be connected, and hopefully we will continue this interaction as we take this telemedicine and doctor on your line more seriously and more actively. So thank you very much. I would now move on to our next speaker, which is Dr. R.K. Upadhyay, Executive Director of CDOT. So Dr. Upadhyay, over to you. Welcome.
Okay, dignitaries on the panel and esteemed audience in the session. This year's theme for WTISD 21, Accelerating Digital Technologies in Challenging Times, clearly underscores the role of ICT in combating the pandemic like COVID, which has taken the whole world in its perilous grip with unprecedented socioeconomic consequences. Nations are working relentlessly to evolve effective strategies, not only to save lives of the citizens, but also keeping the economies afloat. Undoubtedly, digital technologies and ICT have been in the forefront and the key enabler in disseminating critical information to the masses. For example, ICT has contributed greatly in the COVID management and control. Just to name few applications which have been developed by the technical community: COVID contact tracing, quarantine management, COVID resources, vaccine management, virtual medical consultation, bed management, etc. India also, with its IT and technological prowess, has not been behind. It has been using all these applications and have developed this all applications itself. To name few of previous speakers mentioned the app Arogya Setu for contact tracing management, CoWIN for vaccination, COVID Saudhan, which is developed for delivering targeted messages to the target area through mobile phones, and then quarantine alert system, oxygen bed, and so many things. And I'm proud to say that 2 of these applications have been developed by CDOT. The first application is COVID Saudhan, which is actually developed based on ITU CAP protocol, This was basically a protocol meant for disaster management, but we used the same protocol and developed a COVID Saavdhan platform during the lockdown 1 for delivering the specific messages to the targeted area, because this whole platform works on a principle of you take out a geofenced area, and in a targeted manner, all the customers, subscribers of that geofenced area, irrespective of what mobile they hold, will get the necessary message. And this platform was actually not only used for COVID, but subsequently it has been used very, very effectively for cyclone, for floods, for so many things. So I'm happy to say that COVID Saavdhan is still in this current second wave. Also, many states are using this COVID Saavdhan platform for disseminating critical information to the targeted area. The second platform, quarantine alert system, C-Dot quarantine alert system, was also developed in the first lockdown to ensure that the people who are put in containment zone do not cross out. The moment any customer, any subscriber comes out of the containment zone, it used to give an alarm to the state agency as well as the customer, saying that you are supposed to be in consent. This is not being used that much right now, but the C-Dot had been using these, has been providing these platforms. This particular COVID has also done a lot of new things in the work from home scenario. In work from home, VDI infrastructure, virtual desktop infrastructure has come up, wherein safely from your home, your home environment, you can safely and securely connect to your corporate servers and do whatever work as if you are doing physically there. Currently, a lot of VDI suppliers are there. For example, Citrix is there, VMware is there, Amazon is giving this, Microsoft is giving this, and there are a lot of many other applications which has really helped, like previous speakers mentioned, the UPI. UPI has really done wonders, because now even I was never used a UPI, but this during the first lockdown, I learned how to install Google Pay and Paytm and all, and we have been able to, it is a fantastic application which is helping the people. Of course, as was mentioned by the previous speakers, the key pillars for the technology development has to be, it has to be equitable, irrespective of your geographical presence, your resource constraint. The technology should be available to all the masses. In the rural areas, digital literacy is quite low, so your application should be such that that it appeals to a lot of masses. In fact, it had been a endeavor of C-Dot always that our technologies work in urban and rural areas. We have been successful in deriving a lot of technologies which work in urban and rural areas. As an example, I'll just give the example of COVID Saavdhan. Today, COVID Saavdhan platform is working, delivering messages in 16 languages, 16 Indian languages. In fact, the states who are using can decide what language they want to use. So this has really done very wonders. If you don't know Hindi, English, your message will go in Tamil, your message will go in Marathi, your message will go in Odia. So this has been doing, and I'm happy to report that through this platform, till now, we have sent 325 crore messages across the country. We have also developed a lot of solutions which work on solar energy. A lot of our solutions which work in rural areas have been working on solar energy, because we know the electricity is erratic in some of the rural areas. So most of our solutions also come up with the solar power backed up. Internet is truly the fulcrum of digital technologies. And as was mentioned earlier, that BharatNet is a very prestigious product of Government of India for delivering broadband to the village level. And I'm happy to say that BharatNet Phase 1 has been working on C-Dot's GPON technology. We have also recently, because fiber is still to reach all the villages, which has been announced by our Honorable Prime Minister, to bridge the gap, we have tested and successfully tested our Wi-Fi technology for enabling the backhaul from Gram Panchayat to the village, and then using the same Wi-Fi technology for giving the hotspots. So even though fiberization takes little time, our Wi-Fi technology, point-to-point as well as point-to-multipoint, is already enabling the availability of internet in these villages. And as was mentioned, PM1 is one of the important schemes. CDOT is at the forefront of this PM1 scheme. We maintain the central registry for this PM1, and also we help the upcoming entrepreneurs who are coming into this business, because PM1 protocols and the standards are quite different. So we handhold the upcoming entrepreneurs to see that the PM1 proliferates. And I'm sure that as the knowledge about PM1 structure is getting deeper, I think the hotspots will definitely take rapid pace in coming days. I would like to touch upon one more point, that while the robust digital infrastructure is very, very important for our country, but we also must understand that the cyber security and the privacy are taking the center stage. As you are aware that many of these instances of bringing down the telecom network, malicious codes, many countries have banned many suppliers of the telecom, and telecom being the key critical infrastructure, if it goes down, I think that will be disaster for any country. So therefore, while we are looking at the robust digital infrastructure, we also need to look at the cyber security and the privacy issues. On that front, in fact, in the last lockdown, we have developed a WhatsApp equivalent software called Samvad, which is a secure calling and chatting and video calling platform, which is equivalent and which has complete security, which can be hosted in your own organization or which can be hosted publicly in a data center kind of application. And Samvad, I'm happy to report that some of the strategic agencies of our country are already using satisfactorily the Samvad platform. And I would, through this platform, I would urge that anybody looking for Samvad platform, which is chat and messaging and calling solution, which has complete security control, complete indigenous, complete data remains in India, nothing goes out. It is a highly secure system. Similarly, in last lockdown, our Honorable Minister of Communication and IT had given us tasks that develop those days, not many video conferencing platforms were available. We were given literally 15 days time to develop a VC platform. And today I'm proud to say that our VC platform, VC.dot, is being used by many government organizations, IITs, for delivering classes, for meeting conversations. It is very easy to use and it is free tool. So Samvad and VC. And as I was saying that since security is very important and the core of the network, which is the core of any telecom network, whether it is 4G and 5G, if it is not indigenous, you always run the risk of having security issues. So CDOT has developed its own 4G and it is coming up by July with 5G. We are very closely working with BSNL POC, and I'm very hopeful that our POC will be successful and that we will be able, our country will get indigenous 4G and 5G in coming days to come. We have also working on data center technologies. We have developed routers for the data center. We have developed switches for data center, and we are also currently working on developing local servers for the data center applications, because data center also will remain a key infrastructure which should be highly secured. I would only say in terms of, if we need to push our indigenous R&D to a greater scale, I think the investment on the investment towards R&D has to increase. So I think government is taking note of this, and I'm sure that the investment in the R&D will increase. And finally, on this momentous day, I congratulate everyone for this particular day and reiterate the unflinched support of CDOT in bringing technologies which will be safe, which will be secure, which will be equitable, which will work for without any discrimination. Thank you so much.
Thank you, Dr. Upadhyay. Great to have you and great to listen to you. I'm so proud to be associated with CDOT for a long time, and particularly this COVID Savdhan that has been developed. I think this is a great innovation and has really puts India on the forefront of this technology. So thanks for the leadership of CDOT, and hopefully it continues. We would like to work with CDOT to bring out some of these two ITU and APT platforms. So I'll separately work with you on those. So thank you very much. Next, we have Dr. Loknath Dey. Aloknath, I know we have been slightly late, but we would definitely like to hear
Sure.
you, and welcome.
Thanks, Bharatji and ITU-APT for organizing this, and all the dignitaries. Namaste. You know, it is indeed a difficult time, and the doctors and nurses are very busy, from oxygen cylinders to ICU ventilators. Our state government is very busy, whether it is containment zones or paid management systems. Central government, from vaccination clinical trials to allocations. All of these COVID warriors are looking into today's things, and they are looking for saving lives. So as engineering community, we are also supporting them wholeheartedly as community, as NGO operations. We are with them in the way all the systems that we designed in the past are helpful. And as we are hearing it, it's heartening to note. But also we have to make sure, you know, our employees are in place, work from home, global deliveries, many other countries are open, employment needs to be kept. So we are looking for livelihoods. So physicians, COVID warriors for lives, and engineering community for livelihoods. Last week in DST, Dr. Anita Gupta ma'am, and we were there in inaugurating an healthcare incubator, about 11 startups. And as I was discussing with them, I personally have almost 100 issues or kind of areas where a company could be born. And I'm sure I'd not be surprised if 1,000 startups could be born around healthcare in this year. So that initiative is heartening. And it's simple to note, you know, we started in smartphones with pedometer, you know, wellness kind of fitness kind of things. From there, you know, today we have digital sensors which can measure blood pressures. You have this in the apps, ECG, non-invasive way, camera. Just last World Health Day, we launched a program with Arvind Eye Care to prevention of, you know, blindness. So there are many such programs that we could do, and we were encouraging this entrepreneur community to even make these affordable devices, whether it is pulse oximeter, whether it is infrared thermometer. These need to be affordable. We also look into some of the innovations that developed countries are doing. For example, when we're bringing some support systems from Korea on the oxygen concentrator, one of the things I found is on the syringes, you know, low dead space syringe. You can give the same amount of vaccine to one extra person. Instead of 5 people, you can use it for 6 people with this syringe, because the wastage is very, very less. So these are things that we are doing for today. But in this forum, I also would like to take a call for actions. You know, it is not just for today, this is a wake-up call for all of us. And I think we need to look into how we design systems. And my call for action today, in some sense, the way we used to talk about design for maintainability, system design for manufacturability. You know, we came into design for privacy and security some time back. So I think, you know, we want to make sure, you know, if we want to have this ICT spread over all of our people, it has to be designed that way. So design for inclusivity. And this fundamental reason, why are we in this mess for the first place? There are many reasons that people would talk about, but we know that we can do better with environments and in our design. So design for sustainability is also very, very vital. So that if we get into another such situation, we know how to do in systematic way, and we better be not in such system. Now, previous speakers have already talked about Indian infrastructures and how we are helping this whole society. But I just want to take you back in 2010. Just imagine that this thing would have happened in 2010 in India. Today itself, we are finding it difficult to cope, minus the digital India, all the things that we have done in last 10 years, payment systems and our identification systems, all of them, minus that, could have been quite catastrophic. So I think what I wanted to highlight is design for sustainability is very, very vital, because the ICT its reach is growing every day. You know, starting from sensors, we have radiation sensors, proximity sensors, pressure sensors, all kind of sensors. And it's today health tech, but we got also a glimpse of things when locusts were flying over Rajasthan. We saw that. So tomorrow it can be an agri-tech issue. So we should not be looking into just the digital tech only for health. That's, yes, today's need, absolutely. And that's always health is wealth. But also the many other verticals where the digital has not touched, we need to make sure that we accelerate into those. Logistics, we have taken care, and therefore today we're able to get online deliveries. But agri-tech, I don't think we can say at the same space. The storage has become cheaper. All the kinds of files that we are storing, the distributed data systems that have come, flash memory to networked based data centers, processing has become very, very powerful. You used to have DSP and microcontroller. Today, we are applying many of the AI algorithms that can auto detect and help us in big way. And I was giving example of our eye care. This is based on a DNN, CNN based algorithms that we applied into that. And finally, when you do this sensor storage processing, we communicate and analyze. And today we are from LTE to 5G, 5G to 6G. Biggest thing that is happening, earlier we were talking only person to person, person to things, and going beyond. If you have to make a blueprint till 2030, it will be a lot of machine-machine communications. So we have to think it of 20 situations the way we handled, and we are able to cope up in 2020. So we need to think how the world will unfold in 2030, this Connect 2030, as Malcolm was mentioning. We need to look into that and make sure we are much more data-driven, much more interactive, much more systems that are cohesive, like PSLT. Can we not bring into our ecosystem much sooner? Because our police and ambulance, all of them need to be able to communicate in the common frequency. So with that, I would like to conclude by saying the way we have focused on design for maintainability, design for manufacturability, all of these, it doesn't happen in an open loop system design. And I'm going to be asking my engineers, are you checking for thermal, the radiations, all of those details and matrix to be able to make sure that we make a design that is sustainable and not just on the high-end devices, but also it is all inclusive. Some level of features are also available in the affordable devices. With that, I would thank you and happy World Telecom and Information Society Day.
Thank you very much, Alokji. Wonderful presentation. I think the two themes that you have given, I think we should take as a mantra, design for inclusivity and design for sustainability. I think all of us in everything that we do, we must take that as a gospel and implement that. So thank you for those keywords, and we will certainly try to propagate that and show the design things well. And now I think we have our last, not last, but the main speaker, Mr. Vikram Tevitia, because we are all depending on cellular services, and Vikram has been spearheading COI for a long time. So over to you, Vikramji, and of course, then we will have our friend Goelji for concluding. But Vikram, over to you.
Good afternoon, ladies and gentlemen. It's a privilege to be here on this platform as always, and compliments to the ITU-APT Foundation for continuing this spectacular work, even prior to COVID and during the lockdown as well. So compliments to the team of, Dua Saab, Goel Saab, and the whole team at ITU-APT. And, it is so nice to be here sharing amongst all our colleagues, the World Telecom and Information Society Day. And I wanted to begin by congratulating everybody, complimenting everybody, that it is all the telecom fraternity, not just in India, but globally, has been a very, very significant, benefactor towards managing of this challenge, this global challenge. If you just imagine if you did not have connectivity, what the situation would have been. And not just connectivity, but to provide services, because one is connectivity, the other is the theme of the day is the digital transformation, because the data which is available, unless you convert the data, as the previous speakers indicated, into performing something useful for you, whether it is for health or for growing oranges or transporting oxygen or managing the COVID. The fact of the matter is that data or the intelligence has to be built upon that data, and that digital transformation is a extremely important thing for the networks to actually deliver services. Just to highlight, all of us, the combination of connectivity by 4G, the smartphone and the internet, it changed the way you viewed transportation with the likes of the shared economy of, the cab services. It changed the way you view accommodation. The biggest, hotel chain or room is Airbnb. It's not Marriott or somebody, right? So the fact is that these digital technologies and going further 5G, it will change the way you do things. That is what is important, because ultimately, what are we trying to do? All of us are engineers, right? So efficiency is equal to output by input. If you reduce the input by managing your internal resources better, you obviously have a higher efficiency factor. And that is why 5G has even become such a politically hot item globally, because it helps enhance sustainability by reducing the number or amount of resources to be used to deliver a particular service, whether it's a health service, whether it's logistics service, whether it's transportation, or even, let's say today we are sitting at awaiting the cyclone to hit the Gujarat coast. And I'm telling you, in the last 1 year, in between, I had taken time off to organize a WebEx call with all the DOT and telecom service providers and IP ones in coordinating the efforts for Cyclone Tauktae, which we are seeing going to hit the Gujarat coast tomorrow morning. So the fact is that this digital facility is actually helping us coordinate our mutual efforts in a significant way. And that's a great plus point to everybody in the telecom fraternity and of course, all of us on this call. A couple of points, at least, about India, for example. India today has, I was mentioning before the meeting started, is the world's #1 in consuming data. And it's got 13 GB per data connection. It is the highest. And Alok Nath, being from Samsung, will abide by me saying that Korea, which had launched one of the first launches of 5G networks, we far exceed Korea, which is at 8.7 GB with a 5G network. This is from Open Signal, or one of those reports that I picked up. So compliments, are due to the entire Indian telecom service providers and the OEMs that India is on the top of the world in data provision. And that is despite the fact that we've got 1/3 the average global spectrum and much less fiberization. So what is it that we need to do? Is that, of course, some spectrum has got picked up recently in the recent auction. So what operators are getting ready to deploy that spectrum in the networks, and one can, expect a significant ramp up in the 4G speeds. The current average 4G speeds in India are around, let's say, 11, between 10 and 11 Mbps. And with this new spectrum allocation, it can easily be doubled on the same network. Today we have 2.2 million or 22 lakh BTSs. And when you see on Tarang Sanchar, 80% of the network is 3G, 4G. 3G is being waned out, 2G is going out. But India, again, is in the top 5 countries for 4G availability. I heard one doctor saying, you need more 4G in rural areas. But here's the reality. The reality is India is in the top 5 countries for 4G availability. And this recent spectrum auction or, will ramp up that capacity significantly. So that will be a great service delivery to the citizens at large and, bringing more digital services. I'd just like to draw your attention to the fact, to the India stack, for example, right? The India stack, or the combination of the JAM trinity, the Jandan, the Aadhaar, and the mobile. And during the COVID times, the government wanted to pass on the benefits to individuals. And in a short, whether it was for the farmers, direct cash transfers, or the gas, or below the poverty line, all the money into the banks, it was because there was a digital transformation of the fintech sector. I mean, all of us in India should be proud of the fact that Sundar Pichai has recommended at that time to President Trump, hey, how about following what India has done in the UPI scheme, right? It is marvelous, right? So I think we've been doing a great job. And of course, there's always a lot more to do. But today is a day for celebrating the good work that each one of us has done, and compliments to everybody. And going forward, the bright future that I see is all the telecom networks are increasingly, at one time, so far, it was about hardware. You had a lot of hardware part as part of the networks. But a major shift that we see today is the softwareization of the telecom networks. Whether you call it Open RAN or various software parts with the 3GPP standards being issued. So the softwareization of telecom networks and services will certainly have a major impact on the digital transformation, particularly in these challenging times. And Indians, as we all know, are pretty good at software, right? In fact, all the companies, all the global OEMs have got their R&D centers, the second biggest R&D centers here in India. And with this, good ability to handle software, okay, manufacturing is a bit of a challenge, but at least in software, I think we have a pretty good opportunity. And I'm sure all of us in the telecom and the ICT fraternity will leverage this to further enhance the digital transformation of the networks and service delivery in these challenging times. With that, thank you very much once again to ITU-APT Foundation, and compliments to each one of us in the telecom fraternity on the occasion of this World Telecom and ICT Day. Thank you very much.
Thank you, Vikram. I think 3 cheers to you and to the entire telecom fraternity. And I think I agree with you and I join with you in complimenting all our telecom warriors who have been on the forefront of running this closed down society more effectively, more efficiency, as you rightly say, UPI payments, the Paytms and those, and the WhatsApp calls and chats and Zoom calls. Without that, we would not. And somebody said, if it had happened in 2010, oh my God, I don't know what would have happened. Today, at least we are well connected. So thank you very much for bringing those and complimenting.
Thank you so much, Bharat. So, I put my hand up and tap everybody on the back.
Yes.
Yeah. All right. Thanks, guys.
Over to Goel Saab. I think, as usual, Goel Saab, it's your, I know it's a little late, but definitely you will do justice to all the speakers and everybody. So over to you.
Thank you very much. I know we are overset by more than an hour. Thanks to each one of the speakers, delegates, VIPs, starting from AST, Malkan, Chandrasekhar, Deepa Tyagi, Upadhyay ji, Dilip Chenoy, Dua Saab, Bhatia ji, everybody. I don't want to take much time. Briefly, 2 points. One, taking the last point first. When Vikram and we all know that telecom has survived us during COVID for last 2 days, why the hell, I'm using hell intentionally, we have to fight for front warriors for our telecom workers and maintenance staffs for towers maintenance are so. Why the hell? I'm repeating why. Why should we fight? It should come automatically. It should come with a vote of thanks to us in the telecom sector. It is very unfortunate. On the one side, government is dependent on all of us, and on the other side, we are fighting for maintenance things with them. My second point, which I am drawing from Mr. Bharat Bhatia's first slide, to connect unconnected. Lots of data are there, but I am known for giving a specific data where I am the advisor to Vice Chancellor of a university in Rajasthan. 1.5 lakh students. We wanted to offline exams, but we failed. We failed successfully. We failed. Repeating, successfully we failed. And we have to conduct it offline during the hardest of the COVID days because, as usual, the net availability, the smartphone, the speeds, everything. Now, everybody knows this thing also. Everybody talks of this. But why, again, we are faltering? Why we have so much charm for 5G or 6G or 4G? Why cannot we go back to the 2G or 3G? Let us first give them some connectivity somewhere. And as per recent reports, same is the reason for non-proper implementation of COVID vaccination, availability of smartphones. Third, I am very thankful to Upadhyay ji for giving us lots of information about COVID apps, etc. And as Bhatia ji said, we will work out with you separately. We would like to see that they are used world over globally. Thank you very much. Thanks to everybody. Thanks to the team. Wonderful time, wonderful arrangements. Thank you. Thank you.
Thank you, everybody. I think this was a wonderful event. I know we overshot, but I think it was worth it. In the end, I would also like to add my thanks to FICCI, who is our co-partner with this event, and they are also doing another event at 4 o'clock today on this issue. So please do join that event also. And hopefully this camaraderie in the telecom sector continues. So with that, we would log off now, and thanks for joining.